now we'll start more application on what we saw in the morning with Shahir. So the main question we want to ask now is what will happen to the participant of a given treatment if they didn't took this treatment. So the idea is that we compare their situation just to know if this really treatment or this program or this placement have made a difference in their situation or in their outcome that we are interested in, yes or no. So as Shahir explained in the morning, the problem with the dummy variable is that we have the problem of indigeneity and we cannot really use it. So if this conditional exogenity of treatment is not satisfied, as he explained, we need to find other way to explain this. So I skip all this one. Okay. So the problem with this regression approach, first we have the problem of indigeneity. Second, we also have to specify a specific parametric form to run the regression based on the relation between the treatment and the covariates and our variable of outcome, whatever this outcome is, income, nutritional status of children, women empowerment. And this parametric specification can also affect our results. And a third program that using this regression approach, if we just include a dummy variable, we assume that we have equal weight for all the observations, which is not maybe the case, given that it is not random. If it was a random experiment, we are sure that every observation has equal weight or equal probability to be selected, but in non-randomized experiment or in observational data, this is not really the case. Okay. So for this, we would like to estimate exactly what we call the expected treatment effect of the treated. So the idea is that we want to compare the expected value of our outcome variable. Okay. Given that the person is treated, so TI or ZI or whatever is that he is treated, minus what is the expected value of the outcome of this individual if this person is not treated. So I want to compare the situation of the person or of the household if the person is treated and if the person is not treated. This is what we call the expected treatment, average expected treatment. The problem is that this part is not observed. If I'm already in takaful and karama now, you don't know what would be my outcome, my income, if I was not in takaful and karama. This is not observed. So given our data, what we do is that we do the expected value of the person who is treated minus the expected value of the outcome of the person who is not treated. Okay? So this is what we call the average treatment effect that give us the expected effect of treatment for all the individual if they are randomly selected. But given that there is bias, if I add the expected value of the person who is not treated and subtract the same thing, so here is the expected value of the outcome of interest for the person who is treated, minus the expected value of the output of interest for the person who is not treated. These are the two that we observe. If I add and abstract the value of the outcome for the person who is treated, sorry, here is one, but is not observed, so as if I change nothing. So this part minus this part, this is what I really want, which is the difference in the outcome of the treated person if he is treated compared with if he's not treated, and this is the biased. In other words, so the average treatment for the treated is the expected value of the person now who is in takaful and karama, given that he is already in takaful and karama, minus his outcome if he is not in takaful and karama. But there is this selection bias that we explained. This part, the B, is not equal to 0. Why it's not equal to 0? Because this is not random. The fact that the person or the household is now in takaful in karama is related to the characteristics of the person, whatever are these characteristics, observed or non-observed. So the idea with the PSM that we are trying to see So we want to have this condition that the outcome of the person if he is treated and the outcome of the person if he is not treated is independent of our x's. What are these x's? It's independent of the treatment given the x's. These x's are whatever variables that we include that may affect the outcome. For instance, the fact that I am a single mother, how many children I have, where I live, if my parents are living with me or not, if I have an elder boy who is living with me or is living abroad, all these characteristics would affect my outcome, YI, and in the same time would affect if I am treated or not. Okay? For this condition on this axis, we'll try to see what is the probability of a person being selected for the treatment to create two groups, group of persons who are selected and group of persons who are not selected, match it together and compare. Why? Again, because we cannot observe the outcome of this person because he is already treated. So this condition we called the conditional independence assumption, that the outcome of the person treated and the outcome of the person not treated is independent of the fact that he is already placed in the program, conditional on the observations that we have. So this conditional assumption, independence assumption, is not really easily to be verified. So for this, we use the PCM. So again, the idea of the PCM is that I will see what are the x's that would affect outcome of interest, which is the income or the children nutrition status, and would affect in the same time the fact of being selected. So these x's, so I can match two persons based on their age, or I can match two persons based on where they are living, or I can match two households based on their employment status or their education level. So we can match several groups of persons based on several characteristics. So this is multidimensional. The idea of the propensity score matching that will create a kind of score based on this different multidimensional to create two groups. These two groups are treated group and the control group, who has same score or same probability of being selected, but one is selected and the other one is not. And then we'll try to match between them and we'll compare between them. So for instance, if Dalia and myself, we have the same characteristic, but I am in Takaful and Karama and Dalia not, in this case, I can compare my outcome with the outcome of Dalia, and given that we control for the other common variables between Dalia and myself, so any difference between our outcome will be explained by the fact that I am in Takaful and Karama. If I have higher income, this means that Takaful and Karama give me higher income. Why we do this match? Because no one can observe my situation if I am not in Takaful and Karama. I am already in Takaful and Karama. So the only way to compare is to try to find someone with close probability, because this is non-randomized. If it was randomized, we all have the same probability of being selected. So we'll try to match based on this score. Okay, but the question to be asked, what are the characteristics to be included? What are these X? So what are these X? Age, education. Yes, common characteristics, but what are the main characteristics? If only I include, for instance, age, employment status, and education, so this is like, we are generalizing more. We can have a lot of persons who have same education, same age, and same.
The income should be less than a specific income.
No, not the income is not really. The income will be the variable of interest that we want to measure. Family members, location, any variables that exist in our data set and can really affect the outcome. I mean, if we talk about, if the Y is our income, the income will be affected by my age, my sex, my employment status, my education, where I live, the household size, several characteristics. All these characteristics affect my income and in the same time affect the likelihood of being selected for Takaful and Karama or for any other program. So the idea is that we want the choice of X will affect the probability of your choice and will affect the probability of matching the two groups. Imagine that you include a lot of X's, like all the specific characteristics you can include. It would be very difficult to match two persons together. I mean, in other words, it's so easy to find someone who has the same age as myself, the same sex, the same education, and the same employment status. Okay, I mean, it's common to find someone, like two groups who have these four same characteristics. But it's very difficult to have someone who has these four characteristics, who live in the same area, who have same household size, who have the same number of children, who have the same number of income earner in the household. So the more you include X, you are sure to have more closer probability of being chosen, but it will be more difficult to find someone, to find two persons from the two groups. So this is the issue, that sometimes, and also depends on your data, the household size, you may not be able to find a match of your treated person. So it will be very difficult to compare. So the selection of X is really major factor in the PSM, because if you include lower number of X's, you will lose some information, but if you include a lot of information at a given point, you will not be able really to find a match. And this is related to what I said in the morning, that there is no perfect method. There is sensitivity analysis. You have to compare different versions. You may include some variables, a lot of variables. If you find that you cannot find a lot of match and some treated persons have no match, maybe you should change the variables and include other variables. Okay. So what is the advantage of the PSM if I compare it with the regression approach, apart of the endogeneity method? So the first thing, that the regression approach is more parametric method. As I said, you have to select the shape of the function, how it looks like, how they are correlated. But the PSM is considered as non-parametric method, and it does not really based on the relation between the function form between y and t. The other thing, that the regression use the whole data set, so you compared everyone in the data set, even if they are treated or not treated, and even if they are different in form of observable characteristics. But for the PCM, you focus on those who have the same characteristics. You divide them between treated and control groups. So you are sure that everyone in your sample that you are using to compute the PSM, and you are using to compare between the YI and the YI for treated and the YI for not treated, that you are sure that they have the same characteristics. Okay. Are we okay till now? I'm going so fast. Any confusion? Okay. Okay, so the main idea behind PCM, as I told you, instead of matching the individuals or the household based on each characteristic, each X by itself, you create score based on all these X's, and you start matching people with this PSM. So the idea here is that you assume that the match between people is, or individuals or households, is only based on observable characteristics. And this major caveat of PSM. If there are unobservable characteristics that you are not considering, so you are not really sure about your estimates. But again, this is one of the methods that is commonly used, and as you will see in the application I will show you, you have to use several methods and compare, and sometimes even we can mix PCM with difference in difference, as we will see tomorrow. The other thing that, so you calculate the propensity score based on the X that you select, then you start matching these groups together. How you will calculate the propensity score? So I choose my X's, I have to calculate this score based on these X's for all the households in my sample. So, sorry? You give weight to every X. How you will choose the weight? Regression, what type of regression? Logistic or probit. Logit or probit regression. So the idea is that I want to calculate the probability of being treated or not given the X's characteristics. So it's like we have Y variable, which is treated or not treated. That is dummy variable, binary variable, and I will use the logit or probit regression to be able to include the X's with different weights, but we don't know what is the weight. And just we are using a lot treated and not treated, but it's not always only treatment of specific program. It's highly used for impact evaluation for policies, but it can be, for instance, employed or not employed, having someone migrants in my household or not, being empowered or not. So this is kind of treatment. Even this type of methodology is highly used in the health sector, because for instance, doctors want to see if this number of patients who are taking this new medicine will be really healthier than the others, yes or no? So whatever this T means, treated or not, it can be also just the situation of being employed or not, or migrants or not. Question?
Access may be measured in different ways. How we deal with this?
What do you mean measured by different ways?
We have X1, for instance. We use the specific measurement. We have another measurement for another variable, and so on.
But it's like any other regression. So for instance, if I will consider here T is takaful and karama, so X may include the age of the woman who apply, so this is continuous variable. Her education level, so this can be categorical variable. Number of her children, so this is continuous variable, if she is married or not, if she has elder son living in Egypt or abroad. So like any regression, the X's can be any variable, continuous or categorical variable. So you include it in your regression and you calculate what is the probability of being chosen in takaful and karama given all these characteristics. So it's not really an issue what is a measurement unit or what is the type of the data. Did I answer your question or? Okay. So again, so given the X's, we will calculate the probability of being selected for this situation or for this program. As I said, X is a vector of pre-exposure characteristics, and we can estimating using logit or probit estimation method. Okay. Again, the problem, so now I select my X's, I calculate the propensity score matching, and I want to match between my groups. I want to see the individuals who have this same propensity. Of course, no one will have exactly the same propensity score as the other one, because this is a continuous variable. So it's not like 0, 0.5 and 1, so I will find a lot of people who have 0, others have 0.5 and 1, no. But we are trying to find close matches, and we'll see how there is different methods to find this way to match together. But the most important thing is that we want to have what we call region of common support. So this is the density function for the non-participant and the density function of non-participant. You need to have this common area as large as you can to be able to match individuals together. Again, if this region area of common support is very small, you will not be able to match a lot of people because they will not find their match. And if it's really exact, here there is a problem because it's not possible that they all have the same propensity score. So you need to have adequate comparison group to be able to match these individuals together and measure their outcome and find what is the difference between both of them. So from all what I said till now, the impact, the estimate of the impact of any given situation or any given program on the outcome of interest, if we use the PCM, will depend on the choice of the X's and will depend on if there is enough large common area support or not, and how we will match the individuals together. So the first step, what X you will choose. Second step, you will calculate the propensity score. Third, how you will match them. We'll see that there are different way to match the individuals together based on the propensity score. And you will see also in the application, it can have different results. Not huge, I mean, it's not like in one case, the program will have positive impact and on the other case will have negative impact. No, but maybe in one is significant, in the other one not. Maybe it's significant in both and positive, but different values. So this means that you have really to do sensitive analysis based on all these steps that you are going to do.
And you keep all the variables?
The X's? Yes.
Even if they are not significant?
Yes. But I mean, again, for sensitivity analysis, you can include variables and then try to check if, for instance, sometimes when we start an analysis, we think for any reason from our readings or from our observations, especially if we are working on gender issues, sometimes we are really affected by what we observe, that this factor will really affect, for instance, we will all expecting that takaful and karama will increase women's empowerment in Egypt. And women now, they have money, and she is the one who is taking the money, she is the one who going to register, so we're all expecting that she will be more empowered given this program. according to the findings of IFPRI, no, it has no effect on it. So sometimes you need to use other X's or include other ones, exclude other ones. You will have to do sensitivity analysis to be sure that these are really the variables who are affecting your propensity score or the probability of being selected in this program.
But sorry, for the spirit behind PSM, as I understand, and correct me please, is a statistical measure. So I don't expect economic or rational economic behind. So what I'm looking for is, at the end of the day, I get two populations similar. That's it.
Yes, but I'm trying to find.
I put in the question. What is important for me is that at the end of the day, I get two populations similar.
Yes, but how they are similar? I mean, okay. So let me give this example I'm always giving. Shahir and myself, we have almost the same age, same education, same everything. So my students laugh because I always give this example. Okay, so you would expect that age, education, years of experience would affect our income, no? And if we have all this common, we're expecting to have the same wage, same income. So our variable of interest is income, okay? The factors that are affecting this income is the same: age, education, years of experience, okay? So if I want to, but there is another variable that would make our wage different: gender. We are not having the same, okay, he's not getting more than me. But just an example, if we are really typical in everything, but the only difference is gender, you will expect that this will make the difference. So if you want to match me with Shahir, it will be based on the characteristics that would affect the income, if you want to compare income. So this is based on economic intuition. It's not only that you want to match any group with any group. If we are talking about takaful and karama, and assume that the variable of interest is women empowerment, you want to compare women who are member of takaful and karama with women who are not member in takaful and karama, and to see if they are more empowered, yes or no. So when you are calculating the propensity score for being member of takaful and karama, you have to think about the axes that will affect this, and in the same time will affect empowerment, okay? So here it's not just I want to match any groups. No, I want to match women to see what are based on the factors or the variables that affect women empowerment. So again, it will be her age, her education, her parents' education, if she is employed or not, though the employment status is really like, there is problem of indigeneity because I am empowered so I can work, or because I am working, I am empowered. Number of household size, if she is married or not. So all these X's, all these characteristics would affect the woman empowerment situation, and in the same time would affect the likelihood of being member of takaful and karama, because as Shahir said, maybe because I am empowered and I am more active and I have free of mobility, I can go outside my house and go and register for takaful and karama. So they are related. So the choice of X's is not only that I want to match any groups. I want to match them based on variables that would affect my variable of interest from the beginning. Whatever this variable of interest is: income, women empowerment, children nutrition status, children education, whatever. Question? No? Okay. So is it clear? And for this, the choice of X, for instance, if we are talking about women empowerment and I include my education, my age, my marital status, my number of children, but I don't include my parents' education, so maybe given all these X's, I can match a lot of individuals together. But if you add parents' education, maybe here it will become more difficult, because, I cannot really think that it's very easy to match persons according to their education and according to their parents' education as well. Those parents' education affect women empowerment. Okay. So what goes in X, as I said, all what can affect the program placement and in the same time affect the variable of interest of outcome. And if we cannot find good observable variables to explain who participate and who do not participate, we'll have problem eliminating selection bias. So here we are trying just to match people together or match households to eliminate the selection bias. If I cannot really find common support to match these two groups, I will not be able to remove the selection bias. Okay. So in practice, and this we'll see it in more details after the coffee break when we are using Stata, that first we have to predict the probabilities of participation using probit or logit model. Second step, we'll have to match the individuals or our observations based on this propensity score using different methodologies that we'll see now. And then I will have group of treated, group of controlled, so I can compare my outcome of interest in this group with this group. And I know that they have like equal probability of being selected given my propensity score of measurement. Okay. So as I said, you cannot really find exact estimation score. You need to decide how we will match individuals together. So do you have any idea how we can match observations together? So now imagine that you have this huge data set. You have all the observations. You have the values of the propensity score. So instead of comparing education, age, number of children, everything together, you can just compare propensity score. How you can match? Sorry? Intervals. So you'll decide an interval, you see who is in this interval and select them together. So like the closest one. Yeah. Because again, it's a continuous value, so we cannot really find exact value for two persons. You are just trying to see who are close to each other.
You can create a mean value of each one.
So like average of several observations.
And after we can, I think we can create a demi variable if less for this one and with 1 and 0.
Let's only take average, not complicate things more than this. Other ideas? Okay. So we have many methods to make this match. We have simple method is one-to-one matching. So I'm trying to find the observation so I have a lady in the Takaful and Karama. She has a specific propensity score. I will try to find another lady who has close value of the propensity score, but she is not in Takaful and Karama. So this is one-and-one matching. And we can do it with replacement. So for instance, if Dalia and myself were matched together, and Dalia is in the control group, I will not exclude Dalia from my sample. I will add it again and try to match it with Marie, for instance. So you can do both with replacement and without replacement. And of course, this depends on the sample size. And it would affect, again, your results. So you have to do sensitivity analysis. Also, sometimes we can impose what we call caliper. So caliper is like a maximum distance. So because also how you will decide the closest. So maybe you say, okay, the closest till, I don't know, 0.001 or 0.01. So you decide to make like interval of confidence, like you will not go further than this, because the further the observation is, the less the match between both observations. And again, all this will become difficult if you don't have really large or common areas, support area enough to do this match. The other option that sometimes we don't want really to do one-to-one match, because maybe I am treated observation and I have several observations that are very close to me. So I don't want to take one-to-one observation. So I will take the n closest observation. I will create an average or mean from all these observations. So again, what I am doing this, because when you match Dalia with me, you will compare her income with my income. And if her income is higher than my income, this means that being in Takaful and Karama make my situation worse than being not in Takaful and Karama. So this is, so instead of, so one-to-one will be Dalia and myself. Of course, I'm using Dalia because I know her well, so it's much easier to take this example. And if I will take the nearest n neighbors, if Marie, Zelia, and Dalia are the closest neighbors, I will take the average of their outcomes, the three of them. I will match it with my outcome. So, and you can imagine that the results will be different based on this. And again, also we can impose a given value, a given distance till we compare. Okay. There are more complicated methods, which is using kernel matching methodology. This is a non-parametric methodology. where it can create this kind also of average. It give weights, in fact, for the closest observation and create kind of average. But here again, the problem that there are different type of kernel function, and they have the parameter, bandwidth parameter. So again, the selection of the bandwidth parameter and the selection of the kernel function will affect your results. So you can see that there are different choices that you have to make, and these different choices will affect your results and who will be matched with who. So maybe if I use the one-to-one match, the closest one will be Dahlia to me, but if I use kernel match, it will be other groups and will yield to other results. But in general, we'll have the same conclusion. Or the program is improving income, or improving women empowerment, or improving children's status, or not. Maybe one will be significant, one not, but at the end of the day, we'll have the same conclusion. Okay, so after choosing the X's, calculating the propensity score matching the observations together and create two groups, the treated group and the control group. Now we'll have to compare the outcome. So the simple things to do is to make the difference between the outcome of the treated group, so YTG is the treated group, minus the Y of the controlled group. This Y of the controlled group, it will be different if I am using one-to-one matching, or the closest n neighbors, or the kernel matching, or whatever methodology I am using. But whatever, it will be or simple observation or an average, and I will calculate the average on all the treated group. And here, as if I am solving this problem, as if I am comparing the YI of the individual who is treated with his YI if he is not treated, which is I cannot really observe, but I am approximating it, showing this match or through this way of matching individuals together. Okay. Any questions still here? Okay, some notes on estimating propensity score. So we say that one of the advantages of using PCM compared to the regression approach, apart of the endogeneity problem, that this is non-parametric, that we are not really have to have specific function. However, the first step, we have to decide if we are using probit or logit. So we are assuming a given specification of the functions that relate the x's with the probability of being treated or not. So we have to take care into consideration. As I said, there are many modeling decisions that can affect your results. So you need really to do sensitivity analysis to be sure that, I mean, I imagine if tomorrow Prime Minister come and ask me, do you think that we need to continue with Takafra and Karama, yes or no? I cannot really do one PCM with one methodology and said, yes, you should continue, or no, you should not continue. No. We have to make sensitivity analysis to be sure that my results is not really related to the choice of my X, or to the choice of the matching methodology, or to the choice of the groups. We have really to be sure that, because all these steps would affect our results. So we need to, again, even if the results will be close, we need to be sure that we are really have a good specification. Yeah, so this what I already mentioned. Okay. So one of the things, and of course the advantage of Stata or any software, that all these things are already in the output. So you just put the one sentence command and everything will come out, but we need to understand what's it about. That after matching these groups, we need, so now I decide my X's, I construct my treatment group and my control group. I need to be sure that they are really close to each other in the other characteristics, because I want to be sure as if this control group is my counterfactual group, saying that what would be the situation of the treated household if they were not treated. So we need to compare the average or the mean value of all the X's in both groups. So for instance, if I am including age, I want to be sure that the mean of the age in my control group is not statistically different from the mean of the age in my control group. If I'm talking about years of education, I want to be sure that the mean of education years in my control group is not different than the treatment group. Why we want to do this? To be sure that any difference that will appear between my yi of the treated and my yi of the control is not related to any other factor. I am controlling of any other factor. As if Shahir and myself, we are the same person. The only difference between our wages will be related to the gender. Or the only difference between Dalia and myself would be that I am in Takaful and Karama and she is not. So we need to be sure that there is no other difference in the other x's. On average, they are the same values, to be sure that they are really good match, and any difference in the outcome will be related to the fact that they are in this program or not in this program.
But by construction, they should be the same, no?
Yes, I mean, you should not, by construction, but you should be sure that they are not statistically different, and maybe there is any, again, if the choice of x, there is a problem, and they are not really close, just to be sure that everything is fine.
And in this case, what we should do?
If they are not,
Different.
if there are difference, we have to
Change the methodology.
change the methodology. Okay. I mean, in theory, everything should be fine, but when you are really dealing with data, you're not really sure. And we should examine the effect of the matching method on the area of common support. As I said, you should have like enough large area of common support, but if it's so close, if you are so specific to match everything between individuals, it will be very difficult. I may be able to find two households who are both female-headed. The woman has the same education, they have the same number of children, but maybe one will be married and one will be divorced. Maybe one will have an elder son working in Gulf country and the other one not. So the more you include X's, the more you are trying to get close match, the more it will be difficult, and you may find some treated observations who cannot find really a match in the control group. So you have to be in the middle and take into consideration this. So after I estimate the difference or the average treatment effect that is measuring the difference between my outcome as treated and the outcome of the control group, we need to calculate the standard errors to be sure that my results are significant. And there is really significant positive or negative impact of this program on the outcome of interest. The problem that you are calculating yi of the treated and the difference between yi the treated and yi of the controlled that is already based on another estimation. So as if you are estimating two steps. So the standard errors of the second step, which is the average treatment effect, will be large because they are not taking into consideration the fact that the first step is already estimated, which is the propensity score matching. So for this, when you calculate the standard errors to check if your difference is significant or not, you have to take into consideration that it's based on an estimated propensity score. And for this, we need to do bootstrapping to take this into consideration and avoid any issues that will make, or any calculation or estimations that make the standard errors of my estimation very large and show me it's not significant, though it's not really the truth. So this is one of the things that we should consider and take into account when we are calculating our difference average treatment effect. Okay, because if you don't take this into consideration, this will yield to more variation than the normal sampling variation, and if we have more variation, so we cannot really use our T statistics and our F statistics, and we may conclude that the Takaful and Karama is not significant, it has no impact or anything, though in the truth it's true, its effect is significant, but we need to correct for the standard errors. Okay, and this also we see when we are using Stata. Of course, the problem of the bootstrapping that it also differ according to the initial condition you will include in the beginning, and the other thing that based on how powerful is your computer, it can take like 1 day, 2 days. It really depends. So yeah, but you should do this if you want really to have correct standard errors for these estimation procedures. Okay. Here I'm trying to show you what is the difference between the my green screen. هو اللون الأخضر عامل مشكلة معايا. لا هو بيطلع أخضر ما أعرفش. So in social experiment, if it was RCT, everyone has the same probability of being selected. So here I am trying to mimic the same thing, but doing the PSM, but so the propensity score will be constant in this case. As I said, it's trying to match both with equal probability of participation. The probability of participation can be affected by an observable raising, and this is really an issue of PCM. When you are using PCM, you are assuming that you are controlling for the observable characteristics, and you are completely ignoring the unobservable characteristics. And this can make an issue or not making the matching correctly. Because as we said, for instance, for takaful and karama, I can make control group and treated group based on the observable characteristics of the woman and her household. But maybe because of the social stigma, we are both women, we have the same characteristics, but one does not really care about how the community will look at her if she go to the office and register to take takaful and karama, and the other one will not really accept to go to such an office. So here this is just, she is afraid of the social stigma, you cannot really take into consideration, and this is unobservable characteristics. And how you will take this into consideration is very difficult. So this is one of the caveats of PSM. Sometimes we try to solve it by using PSM and the difference in difference to trying to eliminate any type of heterogeneity between the two groups, but still this is an issue that needs to be taken into account. Okay. Any questions still here? Is it because it's so clear or because no? Eh? After lunch. Okay. So this is one of the ways how we use the score, the PSM that I calculated. I compare between the treated and the control. I match between them, and then I compare the outcome of interest. Another way of using the PSM is what we call propensity score weighting. I will use it as a weight for the observations. If you remember when in like ninth slide where I was doing this table comparing between the PSM and the regression approach, that in the regression approach is giving the same weight for all the observations. But in reality it's not the case, because the probability of being selected or not being selected is based on several characteristics. So here in this methodology, I am using the PSM as a weight for the observation to being selected or not. So in the propensity score weighting, I am using as weight for observations, like a sample weight. You know, when you get any data set, I mean, usually you have a weight to be able to see how each observation in your data set represent what exactly in the whole population. So this is the same thing. You will use it as a sample weight. In fact, we'll use the inverse. This is what we call the inverse probability of treatment weighting. So I will calculate the propensity score, and I will divide the value of the observation on it. So the higher the score, the lower the likelihood of being selected. Okay. So we calculate the same thing, probability. Here I am calling it Z, where Z is the vector of, which is our x's, the vector of variables that we want to include in our analysis, which affect the outcome and affect the likelihood of being selected. We will calculate, we'll predict the probability of participation, whatever methodology we are using, probit or logit, the p-hat, and then so we will calculate this weight, which is equal to the fact of being treated or not, divided by the estimated value of our propensity score, plus 1 minus the fact of being treated or not, divided also by 1 minus. So the value of this weight, if Ti equal 1, is equal to what? If Ti equal to 1, if Ti equal to 1, the weight of the observation I will be equal to what? This is like the general formula. 1 over p. And if the person is not treated, its weight will be equal to 1. So this will be 0, and this will be 1 minus 0 over 1 minus. So if I am treated, if I am already member of the Takaful and Karama program, my weight will be the inverse of the probability of being selected in the program. So the higher this probability, the lower will be my weight in the regression. And if I am not member of this program, if I am not treated, my weight will be equal to 1 over 1 minus the probability of being selected. So the higher the probability of being selected, the higher or the lower will be my weight. The lower will be my weight. The lower, the higher the probability of being selected, the higher or the lower will be my weight if I'm not treated, the higher, because it will be 1 minus high probability, 1 over low value denominator, so it's high value, okay? So the weight, as if I am giving weight to the observations related to the inverse of the likelihood of being selected. So the average treatment on the treated, what we are interested in calculating, and if you remember in the PSM, it was the sum of the, it was the sum. So 1 over the number of treated, YG of treated minus YG of controlled. This was the average value of treated, the treatment of treated. Here in this case, it will be related to the weight or the propensity to being selected or not. And we see it also in our in this data. So as if you are doing normal regression and you are just add the weight, but this weight is not the sampling weight, is the weight that you give of being selected or not, or being the likelihood of being treated or not treated. So here you take this weight into consideration. And again, because you are using weights that are not really the sample weight and they are based on another estimation, which is the PSM, we will need to correct for the standard errors not to be larger than the normal, and we will do also robust estimation or bootstrapping.
Sorry, so if we use already the database that we have and we have the sampling weights, we introduce also the sampling weights?
Yes, and the weight of selection. Okay, and also so the weight of selection will be affecting more your average treatment effect. So you can do it this way. So here in the average treatment effect, as you see, you are including the sample size, the weights, and take into consideration the YI of each observation. So it's not like you are matching, you are just taking into consideration, you weight the difference in the YI between treated and controlled. And if you do the regression, you will use it with the sample weight. Again, the weights that we are applying for the treatment and the control group, they should be different and should have different significant means. And the idea that they are unstable and they are affected on also the choice of the axis that you will be choose. So if you have low probability of receiving the treatment, in this case you will get lower weight and will be unlikely to get the treated. So let's make it again. You may have lower probability of being selected, okay? But when you use this inverse weight, you will show that even if you have lower probability of being selected, you are selected and benefiting from the program, okay? And even if you have high probability of being selected in the program, you may be not benefiting from the program. So this shows that sometimes there's inclusion and exclusion. Sometimes the woman will have all the characteristics, and according to the proxy means that she should be in the group, in the treatment, in the takaful and karama, but she is not really included, and she is less likely to be included. For this, we should pay attention, and this is related to the weights we are using, so we have to pay attention that they may be not really accurate enough to include in our analysis. We can stabilize the weight by multiplying by the mean probability of treatment received. So we calculate the average for the whole treated or for the whole controls, and we calculate it, we multiply it by the weight, trying to stabilize the weight so the weight will not really affect our results. Any questions? Results? Now I will present you a paper. It's kind of old paper, but I think it's a really nice paper because it's for many reasons. The first thing that they are trying to measure the impact of subsidized health insurance for the poor, and as Egypt is trying to implement now new health system, so I'm just trying to see how we can measure this once the data is available. The other advantage of this paper is that this program, it has two factors that affecting the selection in the program. So it have like supply factor and demand factor. So you have the part of the demand that individuals themselves will decide to go to be member of this health program or not, to register to this health program or not. But from the government side, also you have some factors affecting the supply because there are some political reasons and regional. It depends you are in which region in this place, and if it's how you decide the threshold based on political reasons. So you have two factors, supply and demand, not only the characteristics of the individual that you have to include in your X, you have also factors related to the government and to the community where the individuals live. So it was interesting how you relate both sides, or you include both sides for demand and supply in your X. And the third thing I found interesting in this paper is that they did many estimation, like many ways of selecting X and many ways of matching, and they use even other methods than PSM, and they are trying to compare all these results together. So I think it's interesting to see how we can have several results and how can these results differ, because again, it's very important, especially if you want to, if you are tomorrow you become the minister consultant and you need to give decisions that will affect the future of the poor Egyptians, you need to think several times before deciding what you will say to the minister. Okay, so the motivation of this paper, as I said, they try to evaluate the impacts of Colombia's subsidized health insurance program, which they summarize for subs, on the medical care utilization. So the treatment, are you member of subs or not? And your outcome variable here is not your income, is not your children's nutritional status, not anything, it's just the medical care utilization. They want to see if mainly the poor who are member of subs, who become member of subs, will be using more medical care or not, how this will be affected. Colombia's subs program is a demand subsidy intended for low-income families where they have screening of beneficiaries take place in decentralized location across the country. And here, as again, there is a part done by the government itself that they're trying to do screening to see who are the poor who can get this program. And at the same time, there is a decision or the characteristics of the individuals themselves to go to be member of this. Because here again, it's a clear example of why there is a problem if you are not randomized. The person who decides to go to be member of this healthcare system is affected by a lot of observable characteristics, but maybe also is affected by the fact that the individual care more about their health or not. Or maybe I am so sick, so I know that I need to use more medical care, so I found this treatment or this program is efficient for myself. So there are some characteristics that we need to really try to remove this selection bias and remove this remove this bias related to the fact that it's not randomized. So what they did in this paper is that they combine household survey data to take into consideration the demand side, the characteristics of the households, with the supply side, which is related to the community and regional data characteristics. So they have individual characteristics and regional and community characteristic. And they compute their propensity score method. As I said, in their x's, they have individual and household characteristics, and community characteristics. So they had the age of the head household, the sex of the head, the education, the employment status. At the community level, they have if it's urban or rural, the expenditure or the budget of the government for this region, some political variables as well. And they're trying to mix these two sides, the supply and the demand, to compute the propensity score to be consistent with the government's decision to offer subsidy and at the same time the individual decision to adhere this program. And what they found, which it was surprising for me because this was written in the abstract, but if you look at the data, I cannot really say that it has really increased the medical care utilization. And this also in the same, like when you look at the data, yeah, it has significant positive impact, but I don't think that it's really increased that way. But it all depends on how was the situation before. Okay, so what they include in their axis, I said, depends on local government decisions and the individual decisions. So for supply side, they have administrative capabilities, political preference. So this also may affect the decision of who will be included or what the government will do in the communities or in the regions. If there is support also from the community give to this political preference or not, and a degree of political scrutiny. And for the demand side, they have, again, the preference toward medical care, attitude toward financial risk, level of access to medical care, if the person is insured or not, and other health characteristics. Okay, what they found, can you see? Okay, so in fact what they did, so they did the analysis for different age groups. And we can understand this because here is medical care. So the medical, if I have children, maybe I will have more incentive to have medical care than if I don't have children. If I am older than 60 years old, I may be more caring to go to subscribe to such a program than if I am lower than 60 years old. So they divide their sample into several groups, age groups from 0 to 4, from 5 to 15, from 16 to 59, from 16 to 59 males and females, because we assume that we have different needs concerning health in these age groups, and from age 60 to 98. And their outcome is medical care utilization, so they use 3 indicators for this medical care utilization: preventive, outpatient, and hospital. And as you see, they use different methodology of matching. 2 we talked about and 2 we didn't talk about. So certification, nearest neighbor is the one we talk about, 1-to-1 matching. Radius is also like kind of average between several closest observation and the kernel. Okay. What you can conclude from this table? Okay. Try to focus. I know it's not really that clear, but so you have, this the first column, the first, the third, the fifth, and the seventh, the difference between each indicator between the treated and the control group, okay? And between brackets are the standard deviation and the stars, of course, for the significance.
Radius is results from using radius.
Radius, yeah, Mr. Doyle.
Difference,
So the results, the first thing you notice that the results, if for instance, if we look for the age group from 0 to 4, you can see that the results differ according to which methodology you are using. If you are using the nearest neighbor and the radius, the results are not really significant at all. For the stratification and the kernel matching methods, you can see that being member of this group have positive significant impact on preventive medical care, significant and positive, and it's around 7%, which means that individuals, poor families who are member of this subgroup will use more the medical care related to preventive medical care. Oops, sorry. Okay. But for the outpatient, whatever methodology you are using, there is no effect of the SUPS program. For the hospital, you can see that it has positive significant effect when using stratification and when using kernel, and it's also around like 3.5%. So if they just use the nearest neighbor or the radius, in this case, they will conclude that this program has no significant effect on the medical care utilizations for children who are between 0 and 4. But you can see if you use other methodologies, so this was kind of sensitive analysis. And in fact, in the paper, they have even other methods than the PSM, but I just excluded because we are not talking about it here, to see the difference. You can also notice that for the use, medical care use for going to the hospital, for the group age between 5 and 15, it has negative impact if you use stratification and registration, but again, it's not significant. It's not significant whatever methodology you are using, okay? And the other thing that you can notice that the impact of the program differ with the age. It's higher in the age 60, 98 compared to the youngest groups, whatever male or female. And the effect is higher in the case of females compared to males. So policy implications that this program will have positive impact on the medical care use of the older people more than the youngest ones. And among the youngest ones, it will be more effective for women than for men. And they have another table in the paper where they divide between rural and urban areas, but they didn't divide it according to age groups. So for rural and urban areas, they are using the whole sample because they don't have enough observation to match according to the age and rural urban area in the same time. And again, they found that urban population will use more, will benefit more from this program more than rural population. So here you can see that it also depends on which outcome have to be used. For instance, like preventive and outpatient are more significant for the three groups, 1659 males, females, and the oldest one. So this may give intuition for the government to change what are the components of the program, or what should be included and what should not be included. So for instance, I don't know what the Egyptian government will do after IFPRI's report, but maybe if they found that it has no really significant effect on women empowerment, maybe they will try to change the amount of income given, or relate this amount of income, of this transfer given to women with employment opportunities, or with more education or training, or raising awareness on other issues. So here you have all the reference I used for the paper, for the presentation. This paper, as I told you, I think is very interesting, and as Shahir said, we'll give it all to you with the slides, so you can read it and you can explore more. This guide of Candler and Colwell is World Bank like report or document where they are really explaining all the quantitative methodologies that we can use for non-experiment data and how we can use it. And again, there is no perfect methodology. You can use two at the same time. You can do sensitivity analysis by doing different methods and try to achieve a final conclusion. Any questions, comments, feedback? Any comments before starting the real? Okay. Okay. ممكن نبدأ نحضر كمان لو عندهم أسئلة في الساعة واحدة. Any question before going to really work with data? Yes.
My problem is that I cannot understand from which point that we can say that it's a good program or not. So we see in your table here, for example, this paper is 7%, for example, for children. 7% is okay. So in comparison to what? So why not 50? Why not 30? Why not? So from which cutoff or points that we can decide that's a good program to, because the idea at the end is to extend the program to the country. So this is the idea, I think.
Sorry? Or to cancel it.
What is the cutoff to decide?
Shahir.
Can I just, perhaps I have 2 points to answer this question. I will answer it through the comparison between what we had in Egypt and other countries, because more or less we can say that the Egyptian program was tailored based on Bolsa Familia of Brazil. So we have a best practice or a benchmark that we can compare with the Egyptian experience. So for instance, if initially Takaful and Karama was developed to replicate more or less what was done in Bolsa Familia, and we see that in Bolsa Familia women empowerment was positively affected, so this means that given that they have more or less the same setup, but they have different outcomes, so this means that we have to improve something from the Egyptian side. If, for instance, income increase or welfare increased by 10% in Bolsa Familia, but it increased by 15% in the Egyptian case, so this means that we're doing relatively better. So I think best practices in general and case studies will be helpful to answer this. That's one. And two, and that was done especially in the case of IFPRI, is that the qualitative analysis complements the quantitative analysis. Because by the end of the day, if we run very complicated and advanced tools, they might give you an idea about the overall effect of the program. But data in general hide a lot of very small details at the individual or household level that will not be able to capture without the qualitative analysis. So this is why in the case of IFPRI, they complemented the quantitative report with another qualitative one in order to see with individual peoples what's your perception, how do you evaluate the program, did you really feel that you're empowered, and so on. So I think those are the two elements that help us identify where we're located compared to other
Okay, just adding to the point to Shahir. So first, if it's good or not or bad to continue it or to cancel it, I think this is mainly political decision. But from like economist point of view, I think if there is 7% improvement in any outcome, especially related to children or to medical care use, I think this is already an achievement. So this is in general important. Related to Takaful and Karama, Takaful and Karama, it was, according to IFPRI, it had good impact on children's education, even if they found that this means spending more on private tutorials and being with or against private tutorials, but at least the kids or children are learning more, and is good on the nutritional outcomes for children. The only problem with women empowerment, and as someone working on gender issues for like 6 years now, how do you measure women empowerment? The questions of measuring women empowerment in most of the data sets used are, do you take the decision alone, or with your husband, or with your husband and your parents-in-law, or you don't participate in the decision at all? And there are several questions concerning what you are going to cook every day, large purchase for household, children's health, visit your family, stuff like this. Frankly speaking, if the woman said, I take the decision alone for what I am going to cook every day, does this mean that she's empowered? It just means that her husband is not really caring about what she is going to eat every day. If she is taking the decision concerning her children's health with her husband, does this mean that she is less empowered? No. So I think there is problem in how you measure women empowerment. What are the variables you include in your analysis? For instance, in the ELMPS, there is a question about freedom of mobility of women, which is part of women empowerment. If I am free to move around, this means that I am kind of empowered. So the question is, when you go to the market, to the local market, when you go to visit your family, when you go to visit a doctor, and when you go to I don't remember the fourth place, to get your kids from school. So do you need to take a permission, or you just have to inform someone in the house, a male person in the house, or you have to take someone with you? I don't know who has children here, but who now go to get their children from school? There is a bus. Who now go to the local market? Or we order delivery, or, so the questions, if I found that, for instance, we found in our paper that the higher income class women are less empowered because their freedom of mobility is lower than the lower income group. I cannot say that higher income women in Egypt are less empowered than the lower income women, simply because lower income women will go to get their kids from school and will go to the market, while the higher income ones, there is the bus that brings the children from school, and they can pick up the phone and ask for delivery. So the idea with women empowerment, for this I was not really surprised by the results. You don't know really how to measure women empowerment. And also another part is related to our region. Sometimes even if I am the one taking the decision, I will not show this in front of our community. My husband is the man and he is the one taking the decision. So even if you ask me who takes the decision, I will say my husband. Even if in real life I am the one who is taking all the decisions. But for our image in the society, it's not really accepted to do this. And the proof of this that, I mean, there are also other positive impact in the qualitative analysis. Some women, when they were asked, you are more empowered, or she didn't really get what is empowered, but what they said, one of the women said that, I feel that I have more dignity now because I have an income that I can participate to have an income in the house, and I bring money to the house. So I feel more dignity. So this, I think, is an important achievement, is that she feels that she can contribute to the household. So women empowerment, I think this is huge discussion in the literature, how you can measure it and how you take the social context into consideration. But if you see that there is improvement in children nutrition status, they are spending more money on vegetables, fruits, and meat, I think this is advantage in a society where 25% of children are stunted. So I think this is really important, I think. Other questions back? Yes.
What diet is used for children?
They're stunted, wasted, and yes, yes. And there are also that expenditure on, I mean, trying to see if there are diversification in food, what they eat or not. If the expenditure on food, vegetables, the different food groups increased or not related to this. Other questions, remarks? Okay, so in fact, in the coming session, we are supposed to start working using PSM in practice. So I don't know. So first, did you all receive the data set? No, Marina, I didn't send it to you. I replied to the group, so I will send it to you now. But all you have the data sets. Okay, do you want me to make like a brief refreshment of data for those who? Okay, just so after the break we will start directly with the PSM. Okay, so just maybe SATA here will look slightly different if you have Windows, but it's the same thing. I mean, I can change it to black. I just prefer white because I'm spending a lot of time with SATA, so I prefer to have it white, but it will be the same things. So you know the Windows, the different parts, or I have to go through what are the different parts? Yes, I have to go through it. No, no, okay. Oh. Sorry? Yeah, from the set. So in the break, I will check this. So just now look at with me. So we will share with you the do file. And as Shahir said in the morning, it's very important. It's very important to write everything in the do file. Even if you are working alone, trust me, tomorrow you will forget why you were doing this command. So personally, when I try to not to do this in this do file because I will share it with you, but personally I write as if I am writing my diaries in whatever language it come in my mind. So sometimes even in Arabophone, Franco-Arab, I wrote like, I did this because I saw there is a problem, so I wanted to try it, blah, blah, blah. So tomorrow when I come and I see this command, I remember why I did this command or why I was thinking about this. So it's better to write more comments to be able to follow what you are doing, and if someone want to see your do file, can understand. Of course, all the comments will be in green. Usually starting from SATA 11, I think it will be in green. And you can write any comment with star in the beginning or slash star, and you end it by star slash or double slash. So whatever will be bright green. All the comments will be in blue, and all the paths will be in red. Okay. So this again, this is a do file where think about it as if your diaries. This is a data set we are going to use. So this is the Egyptian labor market panel survey for 2006. This is not the original raw data. I mean, this is prepared data set to be able to do our exercise. This was prepared by Ragi Asad and Caroline Crafts, even the do file, but I add some comments to it. So here we have the individual ID, the household ID, and several characteristics that we are going to use in calculating the PSM. Of course, the advantage of SATA is that you can write all the commands by your hand, or you can use like tabs and menus. And one of the things that I'm a big fan of SATA. One of the things I really appreciate that if I think of something, I don't know, I want to tabulate, assume that you don't know how to tabulate any two variables, and I don't know what is the command, how to do things. So I will go to Google and write how to make a table with 2 dimensions using SATA. And you'll find huge pages explaining for you how to do this, and a lot of presentations. And the SATA community users, there is this kind of newsletter where you write question and they answer you. They are amazing, they are very good. The problem is that if you subscribe, you will receive hundreds of emails per day. So yeah, I mean, at a given point, I subscribed because I had to do a specific program for my thesis and I didn't know how to do it in SATA. The developer of the command who wrote a paper on this sent me his do file, everything. Everyone was answering me all my questions, but at a given point, my email couldn't really receive more. So what I want to say is that it's really easy to find the question you have in mind. The help is very good. You have a lot of documents on this, a lot of presentation on this. So I think it's very user-friendly, and you can develop your skills using SATA very easily. So some basic how to say, commands that we need to know when you use SATA. Okay. So here, as you see, just like a description, what is this about? Clear all, just because it depends what version of SATA you have and the memory of your computer. Sometimes SATA cannot really produce anything because the memory is really full and cannot do any regression or save any data. So when you do clear all, you are trying to say, okay, clear all what you have in your memory and we start fresh. Set more off. Because when you have a lot of results in the beginning, when you are doing a regression, and this regression have a lot of results, sometimes it show you like one page and you have more, so you have to click on more to see the second page. If you already know what is it about, you can just set more off. So you avoid this and you have all the results in one page. Here, okay, this is one of the things I learned when I started working with a co-author in IFPRI. So imagine you have like a do file of 500 lines. And in these 500 lines, you have like 30 lines where you open a file and you save this file. So I am using on my computer, I send it to Shahir, and Shahir has to change the directory for all these 20 lines of files and 20 lines for saving these files. It really will make you going crazy. So here is just a way that I am saying telling Stata that you have this directory, which I called original data, where I have all my original files, and I create another directory, which I call temporary directory, where I will save my files. And then I am using a kind of abbreviation. So whenever I am using or saving a file, it will go directly to this. So when I am sending my do file to Shahir, all Shahir has to do is to put my directory as comments and write his directory and run his do file. So it's just easier way, especially when you are working with someone else. Okay, so capture, it makes Stata continue working without, even if there is error. I don't really recommend to do this, because when there is error, you need to see what is the error and what is going wrong, but I wanted to keep it to show it to you. So here, as you see, when I'm using this file, international migration data, I'm just telling Stata go to original data, and I add the $sign. So they will go to the directory that I specify in the beginning and will look for this file. So just for simplification things. And clear, because if there is any open file before, so it will just clear it. So again, this data is about, it's from the ELMPS. We are trying to see the impact, because in our region we have the lowest female labor force participation. Only 20% of women who are in age of working are participating in the labor force. And a part of the literature trying to explain this by the international migration of the husband or of the male and remittance. And this decrease the willingness of women to go to the labor market and to start working. So here we are trying to see the impact of migration on the labor force participation. So our treatment is what exactly? Our TI is what in this case? If the husband is working outside, or is international migrant or not, or any male in the household. And our variable of interest is what? Participation in labor force. So we are interested in women aged between 20 and 49. Okay, we have as so we define age group 1 if women are in this age, to keep this, to specify that this is a sample we want to tackle, because here we have all the other age group. We use, these are our x's. So here also it's a command where I'm trying to explain that for Stata that include all these variables in x1, this will be our x's that will include for calculating the propensity score matching. So we have the age squared. We have several education levels. I will talk about it in details after break. We have if she is ever married. Ever married means she is married, widowed, or divorced. Number of children under 5 years old in the household. Number of children between 6 and 14 years. Elderly in the household. And this, if there is university or intermediate education after secondary, and if she is, the husband is unemployed or not. So these are the variables we are including in our data sets we are going to use. And I will not talk about the IV now, but as Shahir said, that we can use IV methodology to solve the problem of indigeneity of the treatment. So one of the mostly common variables, command to use is D. So D allows you to see what are the different variables, what are their type formands, and the definitions. So it's very important when you are using data, especially if you have data like this, that it's not really the raw data. If it's the raw data, you can look at the questionnaire and you will know everything. But if someone else worked on the data and changed, I am one who is big fan of changing the name of the variables and making it very long to me able to understand. So if you will use my data set, you will need to understand what is it. So it's very good to understand. For instance, here, ever married explains that is dummy variable equals 1 if ever married, education level 1 if they have preparatory education or less, region is urban or rural, qism is markaz. So it's very important to see the description of the different variables. And as you see, here is more because the page is longer. So I have to do this. Another command that we will use a lot is the summarize command. So here I want to see the descriptive statistics of all the variables in X1 and IV if the age group equal 1, which means if women are between 16 and 49, and if there is no remittance, there is no migrants in the household. So remit underscore no M means that there is no migrant in the household and there is no remittance received. So we want to see the descriptive statistics of this. Of course, for some variables, for the categorical variables, it has no meaning to do sum because it's just 1 and 0. But for instance, for age, so you see that the average age of women who are living in household where there is no migration and no remittance, they are around 31 years old. Number of children under 5 years old is like around 1. The average number of children between 6 and 14 is also around 1. Elderly is around 1 as well. And you have the number of observation and minimum and maximum.
Just a minor comment. Do you have an idea what does the mean represent for a dummy variable? I mean, a dummy variable in general has either 0 or 1. But here in the summarized table, we get a number for the mean.
For instance, ever married?
The number of deleted sample is the number of deleted mean.
I mean, so it's the share, not
The share.
So the share of those who have this characteristic.
So for ever married, for instance, here,
81.
81% are ever married, which means that you were married, divorced, or willed. But usually we use tab to see if we have several categories to see what are the percentage of those who are ever married or otherwise. Okay, so usually if you do, and as Shahir said in the morning, it's very good to do all these descriptive statistics and these graphical presentations because it gives you a hint of the data, what is going on, and sometimes it's really necessary to understand your results and to see if the raw data proves this or not. And of course, you do whatever you want, graphs, tables, is as you wish. We break now? Yeah.
In the formula of the x's, you included the age and age square. Why we did that? Is it based on a theory? Or?
Yes, because so here your y variable will be the probability of participating in the labor market. So usually with age, if you include only age and it's positive, so this means that the older I become, the more I will participate in the labor market. But at a given age, this participation will decrease. No? So there is non-linear impact of age on labor force participation. So when you include the age squared, you take into consideration this non-linear. Yeah. Okay, so we'll break now. We'll come after we start working with data. If anyone has problem with the data, would you please tell me so I can send it or check it with you? Anyone has problem with the data? Okay. Okay.
Type, we'll break and we'll restart at 3:30.
3:30.